Under the CPB Troubleshooting Simplified series, today we will see about sweep gas failure. When sweep gas failure happens, it can lead to hypoxemia, hypercapnia, hypocapnia, unnecessary emergency oxygenator changeout call. How it can be caused? When the sweep gas system component consisting of a gas flow meter, O2 air blender, anesthetic gas vaporizer, and gas tubings found defective or connections are loose. Obstruction of oxygenator gas outlet port, unnoticed flow meter setting causing excessive sweep gas flow, defect, or crack, or leak in the oxygenator or the gas line which is connected to the oxygenator found kinked. What are all the precautions to be taken to avoid this? First of all, pressure test the sweep gas circuit prior to CPB using an inline pressure manometer to test for leaks. Always keep standby oxygen source, an E-tank or oxygen outlet from the wall or anesthesia machine with a gas line long enough to reach the oxygenator. Perform visual assessment of the oxygenator exhalation port for a blood leak. Visually confirm the correct gas flow through air oxygen blender flow meter prior to CPB. With the blood prime, visually confirm the oxygenation of post-oxygenator blood by color change. How do you manage the sweep gas failure? First of all, call for help. Connect backup oxygen E-tank gas line directly to the oxygenator to eliminate the sweep gas system as the cause for the failure. If it is determined that the sweep gas system is the problem, have backup sweep gas system connected to the oxygenator. If backup sweep gas system is not available, temporarily use anesthesia machine blender gas line.